When you think of plastic surgery, you probably associate it with women. But this morning, I'll talk to a plastic surgeon about why more men are going under the knife. Well, more than ever before, men are turning to easy fixes and some cosmetic surgery solutions for looking younger and feeling healthier. According to industry reports, male cosmetic products are the fastest growing segment in the skincare market, and more than 1 million plastic surgery procedures were performed on men in the year 2001, like this guy here. But joining us today is Dr. John Mendelsohn, Medical Director of the Advanced Cosmetic Surgery and Laser Center in Hyde Park. And I have to ask, we were talking a little bit while Cindy was doing the weather. You've actually had a procedure done. Tell us about that.
Well, I've had Botox done.
Okay, which is an injection.
Right, and probably most of your viewers understand what Botox is. It's an injection that actually eliminates the frown lines, the forehead creases, and the crow's feet. And if you're looking at me right now, the Botox isn't working. But if I raise my brows, you see all these lines here, and those were gone, actually. Usually the treatment lasts between 4 to 8 months.
And did you like it?
Oh, I love the results. You know, it's a quick little injection. One of my nurses actually treated me, so yeah.
Well, I guess it's available to you, so why not? Now, here's the question. Why are more men getting involved in plastic and cosmetic surgery?
Well, you know, women don't have the market cornered, you know.
You know, we were saying that it feels like a double standard here.
Well, I'm not sure exactly what you mean by double standard, but I think over the last 5 or 6 years, the increase has gone from a little under 6% of facial cosmetic procedures being men to close to 20%.
Really?
I think, you know, men want to feel good about themselves. It builds self-esteem, self-confidence. One of the most common reasons for men and women is that they're competing with younger people in the workforce. And so looking better, feeling better, I think image does play a role in careers.
Are you seeing men like age 30 and 40 and higher?
We're seeing men even in their late 20s. I mean,
Really?
We're seeing men, especially for these quick fixes, Botox, chemical peels, skin treatments, those sorts of things.
Okay, now I would imagine when I think about men, the thing that they most worry about is their hair and losing it. Is that wrong?
Well, I think some men, you know, some men are very concerned about that. Yes, that's a large segment of. There are non-surgical and there are surgical procedures. We talked about some of the non-surgical. From a surgical standpoint, some of the most popular procedures are rhinoplasties, nose jobs, eyelid procedures, facelifts, and hair restoration, hair transplants. So
what happened to the whole thought that men become more rugged and appealing as they get older, that sort of Sean Connery, Harrison Ford thing? I guess that's not really fine anymore.
I don't know, maybe it's not working out. Maybe women are pressuring them to look better.
Okay, okay. So it's the same though for women as men. Cosmetic peels, same thing.
Yeah, same thing. I mean, obviously skin types are different. There are different things to consider with men, but yeah, basically the same types of procedures. Okay,
so how should people go about finding a plastic surgeon, and what are good skincare products for men and women? But we're talking mostly men here.
The first part of that question, I think that with any physician, you're looking for someone who specializes in a certain area. If I were to have a problem with my hand, I would see a hand specialist. If you had a problem with your foot, you'd see a foot doctor. So you want to make sure somebody's doing procedures in their specialty, and they're board certified to do so. In terms of skincare products, that's a multi-billion-dollar industry, so you can buy anything you want. I think that as long as you're going to somebody who understands the skin and is providing some information about products, you're probably in good shape.
I think this is a topic that isn't talked about very often, so probably, you know, and I'm not judging anyone, certainly not at all. I mean, I'd have anything done if I could afford it, so we'll talk about that some other time. But I think it's interesting, and I think it's a fascinating topic, and I applaud men who can say, you know what, I want to do this and look better for a longer period of time.
Well, good. I think you should.
I bet you do. Well, thank you for joining us, Dr. Mendelsohn, and we will be right back.
Thank you.
I think it's interesting.